Welcome to my channel. In this video, we will discuss 12 daily habits that can slowly damage your kidneys. Kidney disease is a global health problem, affecting about 10% of the global population. Kidneys are two bean-shaped vital organs responsible for filtering our blood, removing waste and toxins from the blood, helps in maintaining blood pressure, acid-base and electrolyte balance, helps in activation of vitamin D for strong bones, and produce Erythropoietin hormone that stimulate production of red blood cells. Before we begin, don't forget to hit that subscribe button and the notification bell so you don't miss any of our informative videos. So let's dive right in. Number 1. Excessive salt consumption. High salt intake can lead to higher blood pressure and fluid retention throughout the body, putting an extra strain on your kidneys. Increased pressure in the blood vessels can cause damage to the delicate filtering system within the kidneys, known as nephrons. Over time, this damage can impair the kidney's ability to effectively filter waste and excess fluids from the blood. To maintain kidney health, it's essential to manage salt intake. The general recommendation is to limit daily sodium intake to around 2,300 milligrams, equivalent to about 1 teaspoon of salt, or even lower, especially for individuals with high blood pressure or kidney issues. Choosing fresh whole foods over processed and packaged ones, such as canned soups, sauces, and snacks, and avoiding excessive use of salt in cooking. Read food labels and choose products with lower sodium levels. Prefer herbs, spices, garlic, ginger, and other flavorful ingredients to enhance the taste of your dishes without relying on salt. Number 2. Poor hydration. When there's not enough water in the body, the kidneys adjust by producing concentrated urine to conserve water. This concentrated urine can lead to the formation of kidney stones. These stones can obstruct the urinary tract, causing pain and potentially damaging the kidneys over time. Proper hydration is also essential for maintaining adequate blood volume and blood flow to the kidneys. When you are dehydrated, the volume of blood circulating through the kidneys decreases, and it compromises the detoxification process, leading to the accumulation of harmful substances in the kidneys. Prolonged dehydration can contribute to the development or progression of chronic kidney disease. To maintain kidney health, it's crucial to stay adequately hydrated. The general recommendation is to drink about 8 cups or 64 ounces of water per day, but individual needs may vary based on factors such as age, activity level, and climate. Pay attention to your body's signals, such as thirst and the color of your urine, to gauge your hydration status. Number 3. Overuse of painkillers. Overuse of painkillers, especially non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can contribute to kidney damage. These drugs work by blocking the production of prostaglandins, which help in regulating blood flow to the kidneys. So, by inhibiting prostaglandins, they can decrease blood flow to the kidneys, potentially leading to kidney dysfunction, especially in individuals with pre-existing kidney conditions. Long-term and excessive use of these drugs has been linked to an increased risk of developing chronic kidney disease. Overuse or misuse of these drugs can also lead to acute kidney injury, a sudden and temporary decline in kidney function. To minimize the risk of kidney damage, make sure to take painkillers only as directed by your healthcare provider or as indicated on the label. Avoid exceeding recommended doses. Maintain adequate hydration, as dehydration can exacerbate the potential negative effects of drugs on the kidneys. If you have pre-existing kidney conditions or other health concerns, consult with your healthcare provider regularly to monitor kidney function and discuss the safest options for pain management. Number 4. Overconsumption of processed foods. Processed foods are often loaded with excessive amounts of sodium, salt. High sodium intake can raise blood pressure and increasing the risk of kidney damage over time. Unhealthy trans fats and saturated fats in these foods can lead to obesity, diabetes, and cardiovascular diseases, all of which are risk factors for kidney damage. Some food additives and preservatives used in processed foods may contribute to inflammation and oxidative stress, potentially harming the kidneys. Processed foods are typically low in essential nutrients like vitamins, minerals, and fiber, and may contribute to overall poor health and compromise the body's ability to protect and repair the kidneys. Choose fresh fruits, vegetables, lean proteins, and whole grains over processed alternatives. Be mindful of food labels and avoid products with high levels of sodium, unhealthy fats, and additives. Prefer home-cooked food, or at least minimize the frequency of consuming fast food and takeout. Number 5. Excessive sugar consumption. Excessive sugar intake, especially in the form of added sugars and refined carbohydrates, can contribute to insulin resistance, a condition where the body's cells become less responsive to insulin. Insulin resistance is often a precursor to type 2 diabetes and is associated with an increased risk of kidney disease. When sugars react with proteins in the bloodstream, they can form compounds known as advanced glycation end products. These compounds can accumulate in various tissues, including the kidneys, contributing to tissue damage and dysfunction. Excessive sugar consumption may also contribute to chronic inflammation and oxidative stress in the body that can harm the kidneys and play a role in the development and progression of kidney disease. Reduce the consumption of sugary beverages, processed foods, bakery items, and desserts that contain added sugars. Check food labels for hidden sugars under various names like sucrose, fructose, and high fructose corn syrup. Number 6. Excessive smoking. Smoking has a vasoconstrictive effect, meaning it narrows blood vessels and reduces blood flow to the kidneys, thus impairing their ability to filter waste products from the body. Smoking is a well-established risk factor for kidney cancer. The harmful chemicals in tobacco smoke can damage the kidney cells and increase the likelihood of cancerous growth. Smoking may also increase risk of proteinuria, a condition where excess protein is excreted in the urine. Persistent proteinuria is a marker of kidney dysfunction. Smoking weakens the immune system, making individuals more susceptible to infections. Kidney infections can cause damage to the kidneys if left untreated. Smoking also increases the risk of high blood pressure, which is one of the leading causes of kidney damage and can accelerate the progression of existing kidney conditions. The most effective way to mitigate the risks associated with smoking is to quit. Smoking cessation has been shown to slow down the progression of kidney disease and improve overall health. If you are a smoker and have high blood pressure, managing your blood pressure is crucial for kidney health. Adopting a healthy lifestyle, including regular exercise and a balanced diet, can help control blood pressure. Monitoring kidney function through blood tests and other diagnostic tools can help detect early signs of kidney damage. Number 7. Overconsumption of alcohol. Alcohol is a diuretic, meaning it increases urine production and can lead to dehydration. Dehydration can strain the kidneys as they work harder to maintain fluid balance and eliminate waste products. Prolonged dehydration can contribute to kidney stones and kidney damage over time. Binge drinking can lead to acute kidney injury. Chronic alcohol abuse is associated with an increased risk of developing chronic kidney disease. To protect kidney health and reduce the risk of kidney damage associated with alcohol consumption, it's essential to recognize the potential risks associated with excessive alcohol consumption and take steps to maintain a healthy lifestyle for overall well-being. If you choose to consume alcohol, do so in moderation. Moderate drinking is generally defined as up to 1 drink per day for women and up to 2 drinks per day for men. A standard drink, which typically contains about 14 grams of pure alcohol, is equal to 12 ounces of beer, with about 5% alcohol content, 5 ounces of wine, with about 12% alcohol content, 1.5 ounces of distilled spirits or liquor, with about 40% alcohol content. Limit binge drinking. If you find it challenging to control your alcohol intake, consider seeking professional help to address alcohol abuse or addiction. Number 8. Holding urine. When urine is produced in the kidneys, it travels down the ureters and collects in the bladder. As the bladder fills, it expands, and the urge to urinate signals that it's time to empty the bladder. Holding in urine increases the likelihood of urinary stasis. Stagnant urine provides an ideal environment for the growth of bacteria, increasing the risk of urinary tract infections. UTIs left untreated can potentially lead to kidney infections and damage. Delaying urination for extended periods may lead to the backflow of urine into the kidneys. This backflow can introduce bacteria from the bladder into the kidneys. Chronic holding of urine may contribute to bladder dysfunction, affecting the ability of the bladder muscles to contract and relax properly. To promote kidney health, try to respond to urge to urinate promptly. Drinking enough water helps maintain a healthy urinary system and supports overall kidney function. Number 9. Excessive strenuous exercise. Strenuous exercise, particularly in hot and humid conditions, can lead to significant fluid loss through sweating. Dehydration reduces blood flow to the kidneys. Prolonged dehydration can increase the risk of kidney damage. Intense exercise, especially activities like long-distance running or heavy resistance training, can cause muscle breakdown. Myoglobin, a protein released from damaged muscle cells, can enter the bloodstream and potentially cause kidney damage. To minimize the potential risks of kidney damage associated with strenuous exercise, maintain proper hydration by drinking sufficient water before, during, and after exercise, especially in hot conditions. Gradually, increase the intensity and duration of exercise to allow your body to adapt and reduce the risk of sudden stress on the kidneys. Give your body sufficient time to recover between intense exercise sessions to prevent overtraining and potential kidney strain. Number 10. Ignoring urinary tract infection. Urinary tract infections are infections that can occur in any part of the urinary system, including the kidneys, bladder, ureters, and urethra. While most of these infections are localized to the lower urinary tract, that is, bladder and urethra, and are generally treatable with antibiotics, if left untreated, or if the infection spreads to the kidneys, causing inflammation and infection of kidney tissues. Chronic or recurrent kidney infections may result in scarring and fibrosis of the kidney tissue. This scarring can affect the structure and function of the kidneys, leading to a gradual decline in kidney function over time. To prevent kidney damage from UTIs, seek medical attention promptly if you suspect a UTI. Early diagnosis and treatment with antibiotics can prevent the infection from spreading to the kidneys. Stay well hydrated to help flush out bacteria from the urinary tract. Avoid holding in urine for prolonged periods. Maintain good hygiene practices, especially after bowel movements, to prevent the introduction of bacteria into the urethra. Number 11. Poorly managed diabetes. Diabetes is one of the leading causes of kidney disease. Diabetes, especially when not adequately controlled, can have detrimental effects on the kidneys over time. High levels of glucose in the blood can increase the workload on the kidneys. Persistent high blood glucose levels can result in the formation of advanced glycation end products. These compounds can accumulate in various tissues, including the kidneys, contributing to inflammation and kidney damage over time. Diabetic nephropathy can lead to the development of proteinuria, a condition characterized by the presence of excess protein in the urine. Persistent proteinuria is a sign of kidney dysfunction, and if left uncontrolled, diabetic nephropathy can progress to chronic kidney disease. To prevent kidney damage associated with poorly managed diabetes, maintain tight control of blood glucose levels through medication, insulin, by adopting a healthy lifestyle, including a balanced diet, regular exercise, maintaining a healthy weight. Have regular checkups with healthcare providers for monitoring kidney function through blood tests and urine analysis. Number 12. Ignoring high blood pressure. Hypertension is a leading cause of kidney damage and is a major risk factor for the development and progression of chronic kidney disease. Chronic high blood pressure can lead to a reduction in blood flow to the kidneys. High blood pressure can damage tiny filtering units called glomeruli in the kidneys and cause fibrosis of kidney tissue, impairing their ability to filter blood efficiently and contribute to the progression of kidney disease. Hypertension can also contribute to the development of proteinuria. Persistent proteinuria is a marker of kidney dysfunction and can be a sign of kidney damage. To prevent kidney damage associated with high blood pressure, regularly monitor your blood pressure, and if it is consistently elevated, seek medical attention promptly. Adopt a heart-healthy lifestyle, including a balanced diet, regular exercise, maintaining a healthy weight, limiting sodium intake, quitting smoking, and avoiding excessive alcohol consumption. That's it for today. If you found this video helpful, please give it a thumbs up, share it with your friends and family, leave the comment below for any queries, and subscribe to my channel for more informative content on health and well-being. Thanks for watching.